Today, we are diving deep into a condition that has reached epidemic proportions globally and particularly here in India. We are talking about type 2 diabetes mellitus. This isn't just about cutting out sugar, it's a complex metabolic disorder that affects how your body uses its primary fuel source, which is glucose. Think of it as an energy crisis happening inside your body's cells. Now, in this video, we'll unravel the science behind type 2 diabetes. We'll explore how it's diagnosed, break down the powerful medications used to manage it, from metformin to the latest injectables, and discuss the vital role of lifestyle, including some insights from traditional Ayurvedic practices. So, beginning with what and why means how diabetes takes place and why it takes place. So, to understand diabetes, let's just use a simple analogy, the lock and key method. Imagine every cell in your body needs glucose for energy. The glucose is waiting in your bloodstream, but it can't get inside the cell on its own. It needs a key which opens the lock. So, that key is a hormone called insulin, which is produced by the beta cells in your pancreas. When insulin binds to a receptor on the cell surface, the lock, it opens the door and lets glucose in. Okay? In type 2 diabetes, this system breaks down due to two major problems that develop over time. Here we are simply saying that beta cells in your pancreas are the lock, okay, which opens the gate, and insulin opens the gate for the glucose so that glucose can enter into your bloodstream. Now, what are the major problems that develop over time? First is insulin resistance. This is the first and primary issue. The locks on the cells become rusty and resistant. The cell doesn't respond properly to the insulin key. This means glucose has a hard time getting into the cells and starts to build up in the bloodstream. Means they get accumulated without getting used by the body. So next is relative insulin deficiency. Here insulin is deficient, means insulin production is less. When the body senses this resistance, the pancreas goes into overdrive, pumping out more and more insulin to try to force the lock open. For years it might succeed, but eventually the beta cells get exhausted. They can't keep up with the high demand anymore, and insulin production begins to fall. It's not a complete absence of insulin like in type 1 diabetes, but it's not enough to overcome the resistance. This combination of insulin resistance and a failing insulin supply leads to chronically high blood sugar levels or hyperglycemia, which is the hallmark of diabetes. Okay, now we will talk about the causes and risk factors, how diabetes takes place and why. This isn't something that happens overnight. Okay, the risk factors are a combination of things you can't change and things you can. Okay, genetics you can't change. It is inherited from your family tree. Okay, a strong family history significantly increasing your risk. Okay, ethnicity, people of South Asian, African and Hispanic descent have a higher genetic predisposition, means they have high genetic differentiation, means they are not that much resistant to diabetes. Okay, next is age. Risk increases over the age of 45. After 45, your body needs better vitamins and proteins. When it doesn't get that much of vitamins and proteins, it starts building glucose and starts increasing, it starts progressing the diabetes. Okay, obesity is also a major issue. This is the single biggest risk factor. Excess body fat, especially visceral fat around the abdomen, promotes inflammation and release, means you have to lose your belly fat faster. Okay, substance that worsen insulin resistance. Now another is sedentary lifestyle. Lack of physical activity contributes to both obesity and insulin resistance. Okay, you must do physical activity every day for about 30 to 40 minutes, or you can do yoga. No need of doing high intensity exercise, you can do simple exercises. Next is unhealthy diet, a diet high in processed foods, sugary drinks, and unhealthy fats fuels this process. A diet high in processed foods, sugary drinks, and unhealthy fats fuels this process. Means you have to eat healthy. You don't drink sugar drinks. Means don't drink any liquid. It simply increases your sugar. Means you if you want, you can eat whole fruit at a time, but don't make juice out of it. Signs and symptoms. In the early stages, type 2 diabetes mellitus can be silent, just like hypertension. But as blood sugar level climbs, classic symptoms may appear. We call them the 3 Ps. Okay, 3 Ps. It means polyuria, polydipsia, and polyphasia. What is polyuria? Which is frequent urination. Your kidneys try to get rid of the excess sugar in your blood by filtering it into your urine. This sugar pulls water along with it, making you urinated more often. Then, what is polydipsia? Increased thirst. All that urination can lead to dehydration, making you feel constantly thirsty. Polyphasia increases hunger. Even though there is plenty of sugar in your blood, it's not getting into your cells. Your cells are literally starving for energy, which sends hunger signals to your brain. Okay. Other symptoms include unexplained weight loss, fatigue, blood vision, and sores that are slow to heal. Now we will talk about diagnosis and monitoring, how we can diagnose and how we can monitor it. Okay, diagnosing diabetes involves simple blood test that measures glucose level. There are three main tests. First is hemoglobin A1C, which is also known as HbA1c. This is the most common test. It measures your average blood sugar level over the past 2 to 3 months. An A1C of 6.5% or higher indicates diabetes. Means 5.5 to 6.5 is pre-diabetic phase, and 6.5 above is the diabetic phase. If you have less than 6.5 HbA1c, then you must consult a physician faster. Fasting plasma glucose. What is fasting plasma glucose? This measures your blood sugar after you haven't eaten for at least 8 hours. A fasting level of 126 mg per dl or higher indicates diabetes. Next is oral glucose tolerance test, OGTT. You drink a sugary beverage and your blood sugar is tested 2 hours later. A level of 200 mg per dl or higher indicates diabetes. Basically, this test is a hypothesis. This test is not used regularly. Rather, HbA1c test, fasting blood sugar, and other tests are used. Okay, fasting blood sugar and HbA1c test are much more used. Now it is also important to know about pre-diabetes. This is when your blood sugar levels are higher than normal but not high enough for a full diabetes diagnosis. An A1C between 5.7 and 6.4 is considered pre-diabetic, which I have told you earlier. Okay, this is a critical warning sign and a golden opportunity to make lifestyle changes to prevent or delay the onset of full-blown diabetes. I will say you that you can prevent diabetes in pre-diabetic stage if you change your lifestyle. Okay. Now we will talk about pharmacological management. What are the drugs? How they are used? How you must stick to the drug adherence. Okay. The goal of treatment are to manage blood sugar, targeting an HbA1c below 7%. Controlled blood pressure and cholesterol, and ultimately prevent the long-term complications of diabetes. Lifestyle is the foundation, but most patients will need medication. Let's explore the major classes. Okay. First line therapy for diabetes mellitus type 2 is metformin, which is of biguanide class. What is the mechanism of action of metformin? Metformin is the cornerstone of type 2 diabetes mellitus. It works in three main ways. It dramatically reduces the amount of glucose in your liver produces. It increases the insulin sensitivity of your muscle cells so they can take up more glucose, and it slightly decreases the absorption of glucose from your diet. Okay, means basically it reduces glucose entering into blood and getting deposited there. It tries to use it. So what are the key points of metformin? It does not cause weight gain, and it can lead to modest weight loss, and has a very low risk of causing low blood sugar, which is called as hypoglycemia. Okay. The most common side effects are gastrointestinal, like nausea or diarrhea. If metformin isn't enough, other agents are added. So what are the known side effects of metformin? Which is gastrointestinal effects like nausea or diarrhea. These are not severe. If you take higher dose, then these side effects can be severe. So now we will talk about the sulfonylureas, which are glimepiride or gliclazide. Okay, these drugs act directly on the pancreas, stimulating the beta cells, to release more insulin. If insulin release increases, then the glucose is used. When the insulin increases in your body, the glucose absorption increases, means better utilization of glucose. You can think of them as pancreas squeezers. Okay, what are the key points of sulfonylureas? They are effective but carry a significant risk of hypoglycemia. It can cause hypoglycemia rather than metformin, and can cause weight gain. Metformin doesn't causes weight gain or hypoglycemia. So metformin is the first line treatment for diabetes mellitus. Okay. Now we will talk about DPP-4 inhibitors, which are sitagliptin or vildagliptin. In combination, metformin and vildagliptin is also given. Okay. What is the mechanism of DPP-4 inhibitors? These drugs works by enhancing the effects of natural hormones in your body called incretins. Okay. These enhance the effect of natural hormones, which are incretins. Incretins signal the pancreas to release insulin only when blood sugar is high. Incretins release glucose when blood sugar is high. Okay, DPP-4 inhibitor blocks the enzyme that breaks down these incretins. They block enzymes which breaks incretin, so that incretins can work much more easier without any hassle, to increase the presence of incretin. Okay, so they stick around longer. It's a smarter way to increase insulin. Okay, what are the key points? They are well tolerated, weight neutral, and have a low risk of hypoglycemia, means it doesn't cause hypoglycemia. Now we will talk about SGLT2 inhibitors, which are dapagliflozin, empagliflozin, and canagliflozin. Okay, mechanism. This is a brilliant mechanism. Okay, for SGLT2, these drugs works on the kidneys. They block a protein called SGLT2, means these are SGLT2 inhibitors, which is responsible for reabsorbing glucose from the urine back into the blood. Means reabsorption takes place in the body according to glomerular filtration. So when reabsorption takes place, glucose level spikes up in the blood. So SGLT2 inhibitors, they block the reabsorption process. Okay, by blocking it, excess glucose is not reabsorbed and is instead flushed out of the body in the urine, by the urine. Okay, what are the key points? They not only lower blood sugar but also promotes weight loss. Okay, and lower blood pressure. It lowers blood pressure also. Crucially, they have been proven to have powerful protective benefits for the heart and kidney. Means these are not that much causative agent for the heart and kidney, making them a top choice for the patients with cardiovascular kidney disease. These are the top choice for the cardiovascular kidney diseases. Okay. Now we will talk about the GLP-1 receptor agonists, which are liraglutide, semaglutide, and dulaglutide. What are the mechanisms? These are mostly injectable drugs that mimic the action of the incretin hormone GLP-1, means it simply increases the availability of incretin, thus it can utilize glucose. Okay, they are very powerful. They stimulate insulin release only when needed. suppress the release of glucagon, a hormone that raises blood sugar, means it blocks the direct substance which is converted after the glucagon. These are responsible for high diabetes chances. Okay, a hormone that raises blood sugar. Okay, slow down stomach emptying, making you feel longer, means it doesn't makes you crave, it decreases your craving for food, so that your blood sugar will be maintained. And act on the brain to reduce appetite, means it simply acts on brain signals and sends a signal that now diet or now food is not required. Okay, what are the key points? They lead to excellent glucose control. Okay, these are the excellent glucose control products. And significantly it reduces weight. Like SGLT2 inhibitor, they have also demonstrated major cardiovascular benefits, means it is safe for heart patients and kidney patients. Okay, now we will talk about the non-pharmacological and holistic care. Okay, medication is just one piece of the puzzle. The day-to-day management of diabetes happens on your plate and with your body. Medical nutrition therapy, there is no single diabetic diet. The key is mindful eating. The plate method is a great start. Fill half of your plate with non-starchy vegetables, means decrease use of potato. Don't use potato every time while you are eating. Okay, 1/4 with lean protein, means you can use beans, you can use chanas, means different type of protein sources. Okay, which are healthy and which are economic for you, means pocket friendly. So you must not waste you must not waste that much amount of money on that. Okay, and 1/4 with complex carbohydrates. Okay, like whole grain. Okay, complex carbohydrates means you can eat rotis. Okay, chapatis simply. You can simply eat ragi. Ragi is a grain which is much more beneficial for diabetic patients. Okay, ragi, I am repeating this one, ragi grain. Okay, so now it's about controlling portion sizes and choosing quality foods. Use quality food over quantity food. Okay, do not overburden your stomach. You can take 2 to 3 meals daily or 3 to 4 meals, but take small amount that your body can digest it faster. Okay, exercise is most necessary in non-pharmacological treatment. This is non-negotiable, means every day, every morning you have to go for walk, you have to do the stretching, you have to do the flexing, everything. Means I am not talking about the high impact intensity workouts. Don't do it. Simply jog, simply go out for a jog, sweat out for some time. For sweating out better, you can use a raincoat. Use raincoat for sweating better. Okay, the goal is 150 minutes per week. I will suggest 50 minutes every day, not 150 minutes per week. Okay, every day 50 minutes will lead you to prevent diabetes mellitus if you are in a pre-diabetic stage. And if you are in diabetic stage, 50 to 60 minutes daily will control your diabetes, like you are like you are controlling your authority. Okay, so per week. Okay, intensity aerobic activities like brisk walking, which I told you already, plus 2-3 sessions of resistant training like lifting weights. I will suggest do not do lifting weights, rather flex your muscles, every bit of muscles like hands, legs, body, every part of your body and muscles. You can do massage, you can do stretching. Do lifting weights isn't that much good, but you can do. Muscle is a major consumer of glucose, so building muscle mass is fantastic for improving insulin sensitivity. Okay, go to the gym, build your body, build muscle mass, become bulky, then your body will utilize glucose faster. So means it is a myth that bulking up can lead you to prevent diabetes mellitus. Okay, now we will talk about food care. Food care is much more necessary because deposition of blood sugar increases in food. Okay, high blood sugar can damage nerves, which is called neuropathy, and reduce blood sugar flow. Okay, it reduces blood sugar flow also. It reduces blood flow. Sorry. It's vital for diabetics to infect their feet daily for any cuts or sores, because if there will be cut or sores, the time of the duration to reheal or heal the cut is longer in diabetic patient than in a normal patient. Wear comfortable shoes and never walk barefoot. Okay, regular monitoring is required. This includes checking blood sugar at home, advised by your doctor. Get a blood sugar checker under 1000 rupees. You can get branded products. You can search on net to check blood sugar. Check every week blood sugar, or every 3 to 4 weeks, for preventing diabetes. If you are serious about it, check every week or every 15 days, not every week, every 15 days. Okay, your doctor and getting your HbA1c, kidney function and eye exams done regularly, because diabetes also cause retinopathy. Okay, now we will talk about insights from Ayurveda, which you can include in your day to day life to manage and control diabetes. These are proven, these are having, these are our traditions, guys. Okay, these we must follow, because our elders have told that these are beneficial for us. If they have told us, it means they have some type of proof, or they would have interacted with it, or they would have, उन्होंने खुद से महसूस किया होगा यार. इंग्लिश मैं भूल जाता हूँ बीच बीच में, भाई यार होता है यार. Now, especially from in India, many people are interested in traditional approaches. It is absolutely critical to understand that Ayurvedic practices should be considered complementary support and must never replace the medical treatment. See, allopathic treatment is great for controlling diabetes, but Ayurvedic, it promotes the influence of allopathic drugs. If you are taking these with the allopathic treatment and you are adhered with the medication of your allopathy, then you will probably prevent it, or you will control it better way. Okay, so these are all burger things. Let's dive into directly what are the things we are going to use in Ayurvedic care. First is Karela bitter gourd. Bitter gourd is a wonderful nature magic product. It cleanses your blood, it reduces your blood sugar, it has enormous benefits. Okay, guys, you must use this. You must eat Karela, but not juice. Okay, you must not juice it. I won't suggest you to juice any fruit or vegetable and drink it, because simply, see guys, when you juice it, when you break down the fruits, they simply convert into high glucose substance. When you directly drink it, they directly spike up the glucose level. If you do not believe me, check once that after eating a fruit, whole fruit, how much level of your blood sugar spikes, and after eating the same juice of that same fruit, how much level of blood sugar spikes. Check by yourself, then you can tell me anything. Okay, now we will talk about Karela, which is bitter gourd. It contains active substances with anti-diabetic properties, including carantine, which is known for its blood glucose lowering effect, and an insulin-like compound known as polypeptide P. These two things are present in Karela and are benefit for diabetes. Never ever, never ever, uh, okay, never ever misunderstood the use of Ayurvedic things or neglect. I was going to use the word neglect, but I forgot. That's why I okay. Never ever neglect the benefits of Ayurvedic things. Okay, now we will talk about jamun, which is Indian blackberry. The seeds of the jamun, means you have to powder the seeds, then you can drink it. Okay, these seeds of the jamun fruit. See, why I am telling you to do the seeds part only, because seeds parts, when you dry it, when you grind it, it simply stores the chemical properties. It doesn't have glucose, but fruits and vegetables can spike the glucose level. They have that much of properties, but seeds, or all seeds, roots, plant parts like bark, like stem, these does not have that much glucose or that much level of increasing the glucose level, so you can powder it and you can drink it. Okay, jamun contains jambolene, a compound. Okay, jambosine, which is also a compound or substance that are believed to slow down the rate at which sugar is released into the bloodstream and may increase insulin availability. May increase, it is saying may increase because to promote allopathy, these things are being told. But I know, and you will also notice that jamun, karela, or other Ayurvedic products, which I will talk in every disease condition, is beneficial for you. Okay, if you do not believe me, you can try yourself. Then you can let me know your things, or let me know your भूल गया, कोई बात नहीं. Gudmar, which is Gymnema sylvestre. The name literally translates to destroyer of sugar. Okay, it is also called as destroyer of sugar. It's thought to help reduce sugar cravings by blocking sugar receptor on the tongue. Okay, and may have role in stimulating insulin secretion and regeneration pancreas islet cells. If beta cells of pancreas will be regenerated, then better insulin production will be there, which will ultimately lead to better absorption of glucose, better utilization of glucose, better everything better. Okay, methi, fenugreek. The seeds are high in soluble fibers. Okay, it contains fibers which helps slow down the digestion and absorption, means it decreases your digestion rate and absorption rate, means if digestion rate and absorption rate will decrease, then intake of your food, intake of your glucose will ultimately decrease, leading to less availability of glucose in your body. Okay, let me sit comfortable. Okay. So what we are talking? Fenugreek. The seeds are high in soluble fiber which helps slow down the digestion and absorption of carbohydrates, thus improving most metabolic symptoms associated with the type 2 diabetes mellitus. These are part of a holistic system that also emphasizes diet and lifestyle, which aligns perfectly with modern medical advice. So what is the summary and conclusion? Type 2 diabetes is a progressive disease of insulin resistance and deficiency driven by genetics and lifestyle. Its management stands out on 4 pillars: diet, exercise, medication, monitoring. Okay, completed, guys. Let me know what are your thoughts upon this.